Hi everyone, Dr. Sam Gaston here with North Texas Sport and Spine, finishing up our March series on common basketball injuries. Started out first week with the lateral ankle sprain, moved in the second week to the patellar tendonitis or jumper's knee. Third video we focused on lower body and torso strains, and this week we're going to focus on common upper body injuries. So it's basketball, ball played with the hands. A lot of times you'll get jammed fingers, jam wrist sprains, reaching for the ball, catching a finger on the ball, on an opponent, jamming it in there at the first joint there, and then wrist again, lots of jams, sprains there, both impacts hanging on the rim, falling and reaching out to catch yourself, what we call the foosh injury, where you fall on the outstretched hand. And then just with all of the contact of basketball, hand, finger, wrist, lots of potential contact injuries there. Elbow, you can get some injuries too as well, both from getting up, rebound, swinging. You can catch somebody with the elbow and get, contusion issue like that. And also, again, with falling with the outstretched hand, that can jam the elbow up. And then, of course, shoulder injuries are pretty common. It is an overhead sport, and there's a lot of repetition as well. So anytime we get high repetition, we worry about different types of tendonitis. We know the rotator cuff is in there. It can be prone to tendonitis, so that is an issue as well. We know bursitis from the shoulder bursts also can be a problem. And then dislocations of the shoulder occur sometimes in basketball, just because there is a fair amount of contact between large humans when you get to the NBA and college level. With these injuries, sprains, strains to the wrist, it's all going to depend on the grade of the injury. We've gone over this with our other lower body injuries, grade 1, grade 2, grade 3. Grade 1, you're looking at sometimes as little as 2 weeks. Grade 2, come closer to 4 to 6. And grade 3, when it can be a complete tear of that ligament or that muscle, that can be surgery, and sometimes they'll miss the entire season with that. With our foosh injury, our fall on the outstretched hand, that can often lead to broken bones in the wrist. And that's going to be a bigger problem, because it's going to take at least 8 weeks for the bone to heal, sometimes up to 12 again, and then you have to work back into shape to be able to play. So these are just some of the common upper body injuries that we do see with basketball players. So now we've got that information, and the important thing to notice is that this also applies to the everyday person. We're focusing primarily on high-level basketball players, but everybody can get one of these injuries, not just from basketball, but from different activities in their day-to-day life. So it's always good to learn about these injuries and see what you can do treatment-wise to help.